Thank y'all, each and every one of you, for being here today. Today's really a special. We've got a lot of things on the agenda. Also, pursuant to the district bylaws, it's my pleasure today to really kind of call this meeting to order. I'm actually doing this in a joint capacity with Dr. Ziegler, obviously because it's the annual joint meeting of the Board of Managers and the Medical Executive Committee. So, Dr. Ziegler, thank you very much. I know you've got a full presentation here on the agenda that we will get to in a moment, but thank y'all so very much for being here. So in order to start, I'd like to call on Chaplain Dave Slee to come forward and do our invocation, and afterwards please join me in Pledge of Allegiance.
We're grateful to be here today to be of service in this institution and to the members of our community. We're very grateful for the skills and talents and abilities that we have. And we ask for guidance and wisdom as we continue to provide health care. Thank you for hearing our prayer. Amen.
Thank you very much. Please join. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Scott, is there any citizens? I've been advised that no one else is signed in to address the board, so I guess we'll go to item number 4, which is the board chair and report. And I'm just happy to say that everybody else has been doing all the work because I've been on vacation the last 8 days and actually missed something that this organization has been working on for many years, which was the Northeast Medical Home groundbreaking, which was last Friday. So I'm not going to take Robert's. He's got several good things to talk about, and so I'm going to let him go ahead and start that. But I couldn't help but read, saw a nice article in the Star-Telegram Northeast about that, and it's not just what this board has done. This has been an ongoing through several of our former presidents with Trent, with Ralph, and everyone as it moves forward. So fortunately, the good things are beginning to happen. So Robert, I will turn it over to you.
Thank you, Mr. Chairman. I wanted to give you, board members and our guests from the medical staff, and also those of you in the audience, a bit of an update on a few things. We had quite a few things going on. We had our, what we call our ADI and our LDI. LDI stands for Leadership Development Institute, and ADI is 400 people that we've selected over time to come. They are throughout the whole network, and they come and we celebrate. And we celebrate victories at JPS. We talk about good things that are happening at JPS, and we have 400 what we call our ambassadors. And they come in and they learn about our goals, how we're reaching those goals, how we're hitting our marks. Then we have one-on-one breakout sessions. We talk, I'm not sure what Melinda's doing at that one because it was supposed to be very serious, but that's Melinda at hers. So we had a very good function. We go to the Hearst Convention Center, and it's very helpful to get the organization to have an idea from its leadership standpoint of where we're heading, where we're going, and how we're being efficient as we possibly can with tax dollars, and how we're providing the best patient care we can provide. The other thing is we have a wonderful situation. We have 14 doctors that were selected by Texas Monthly, which were nominated by their peers. This, you see Dr. Alfonso in this picture. 14 doctors were highlighted in Texas Monthly for outstanding service to the state and outstanding service to healthcare. They are nominated for this award through their peers. Rising stars, although I saw Pastor's head jump up real quick because it thought you was your church. It's not your church, but these are doctors that have been in the profession, physicians have been in the profession 10 years or less, and they're viewed by the community of their peers as people that have an incredible future in their areas and certainly in Texas. So that is on your portal. You can see the other names and see pictures of those folks, which I think is really good and a nice situation for recognition for JPS. We have an issue in nursing that we're quite proud of. You know, there was a time at JPS that particularly in the emergency room, Attrition was a problem. Turnover was a problem. We had a point at one point in 3 or 4 years ago where we had a percentage of attrition of 30%. And of course, our emergency room is a tough place to be. It's hard, and people come and people go. And a lot of times the adage was if you were trained at JPS, you could kind of cut it anywhere. But we were having a hard time sometimes retaining those, and that was a battle that Dorothy and others have fought for over the years. It's a challenge. We've gotten that rate now down to 4.5% in our emergency room, and we're really proud of that number, and we're proud of who we're training and what we're doing. And one of the things that's helped, and you see this here in our residency and our graduate programs, we have a cohort program that we've worked out with Tarleton State. And it is a hugely successful project for us, along with all the work that we do with TCU and what we do with Tarrant County College and what we do with UT Arlington and the other programs that we have with nursing students. This just happens to be the cohort program that we have with our friends at Tarleton State. We are very accepting of all those programs, and those nurses come here, and we find out that we are roughly about an 80% retention ratio with this program of nurses that stay in our program. So when they're trained here, they tend to stay here, and we appreciate that. So not only are they staying once they graduate, getting into our program, then they're starting to move up within our program. So very proud of that. We received 2 wonderful awards. Those of you in quality heard about this award. It is we got an award from the American Heart Association. It was a Quality Achievement Award for what we've done for maintaining the highest standards of care in heart attack patients. We also at the same time received the Lifeline Silver Plus Quality Achievement Award. And those awards are for what we're doing in cardiology and the great work that our invasive labs are doing. You all committed to advancing invasive labs, and what we did, a lot of those results are showing in better patient care, and we're now seeing it with national recognition from organizations. So we're proud of that team. Those are some incredible people in that picture. They fight hard for life, and they are some of the best people you'll ever meet. And none of us can predict what may or may not happen in a situation when heart attack comes or challenges from a stroke or anything else. That is an incredible team. I'm really proud of them. So we've won those awards, and I'm proud of the team for that. And to reference what Chairman Powell said and what so many people worked, that is breaking of ground. There's some really important people in that picture with the exception of myself, but the most important person in that picture is that beautiful woman in the middle. I'm not sure what color she's wearing, but she is one of our patients. And we thought it was really important that our patients help turn ground because that's the only reason we would even be in the Northeast is because of our patients. And she was excited to be there. I don't know that I've ever seen more selfies taken at one point from her and her children who were out there. So that was a really neat function. I was really proud to be there and to compliment this board for your initiative, to compliment the work that you all put into it. Also, Mr. Powell, your efforts, Pastor Emerson's efforts, Trent Petty's efforts, and Scott Fisher. And then when Roger came on board, Roger's commandeering and helping make sure that we did the right things out there was really important, and I appreciate all y'all's work, and then in its totality as a board. And that was a nice groundbreaking. And Commissioner Fickus, I think, was not only proud, but we had a lot of people out there who were part of a community effort for the past 7 years who have put efforts together to try to bring that to fruition. So we had a good month at JPS, culminated by a wonderful situation there. So, Mr. Chair, unless there's any questions, those are some of the achievements and things that we've done for the last month.
Robert, thank you again very much. Like you said, it all comes down to, like I said, the patient was there, and that's what it's all about. So thank you very much. The next item is item number 6, and I think I'll ask Dr. Ziegler. I'm actually going to change place with him, make it easier for him. President of the medical staff, to please come forward, introduce and handle his part of the meeting, and it's all yours, Dr. Ziegler. Thank you. I'm fine.
Thank you, Charlie. I thought the first thing I would do is, this is the Board of Managers, and I thought I would introduce them. These are the guys that the President of the Medical Staff works with. You know Mr. Early. On my left over here is Dr. Weber. Dr. Weber is he was President of the Medical Staff. He was Chairman of the Department of Surgery. He's the Chairman of a claim. For a University of Michigan graduate, it's hard to imagine they could accomplish so much in a lifetime, but I know Kathleen, I saw Kathleen. Kathleen Whelan, I know you're out there. I saw you come in. My apologies to University of Michigan graduates. Most of them I have deep respect for. We have Trent Perry. Petty. I'm sorry, Perry. My mistake. Okay.
No, you're not.
Warren Norad, Roger Fisher, Charlie Powell's the chairman of the Board of Managers, Dr. Roy Lowry, Dorothy DeBose, D.T. Wynn, Dr. Rex Heyer, Reverend Ralph Emerson, and Neil Adams is the lead counsel for the hospital. We have various people here. I thought I would introduce some of the medical staff. What I was going to do is have an abbreviated version of our MedExec meeting that we had last Tuesday and mostly get to the committee reports, but we have Dr. Luke, Dr. Cepeda, Dr. Niakaris, Dr. Manoff, Dr. Fromm, Dr. Z, Dr. Webb, and who else is he? Dr. Casey, Dr. McReynolds, Dr. Gandhi, Dr. Kaiser, and Dr. Elliott. I think those are the main ones that are here. Do I see? I can't see the back row. So what I thought I would do is give an abbreviated version of what we do at MedExec. The first thing that we do is we hear from the CEO and tells us that tells us all his troubles. Then we have some committee reports, minutes that we accept. Then we get to the Board of Manager reports where we talk about all their troubles. And then we get to the standing reports. The first one we'll hear from is Dr. Casey with the Ethics Committee. And you can either come.
A brief overview of some of our functions on the Ethics Committee. It's a medical staff committee, but we also have members from administration and throughout the community, and I will extend this as an invitation. Mr. Fisher was on our committee for 5-7 years or so, and so as a board member, anyone who would like to, please let me know. I think we'd like that. We have ethicists from both TCU and from UNT who have served as well. Our major functions are ethics clinical consultations across the hospital, and we do that daily, averaging a few a week. Our biggest thing also is looking at policies that may come across our desk with regards to an ethical stand biomedical things that may ask us to take a view at and give a perspective on. Certainly not final decision making, but maybe just give what things might be added to it. And then towards those end, there's most ethics committees across hospitals are required now to have an educational program. We've taken that on over the last 6 to 9 months, hitting quite a few things. Our biggest ideas and goals are rights of patients, shared decision making between patients and their surrogates, or their surrogates and with the healthcare team. And then again, looking at all policies and procedures that might have a bearing on biomedical ethics. Thank you all very much.
Thank you, Dan. Next report is the Graduate Medical Education Committee. Dr. Elliott.
Good afternoon. Thanks for the opportunity. Just want to say we're really pleased to welcome our new class of residents who have arrived here. They started their clinical duties on July 1st, 2017. We have 75 brand new interns who are eager and walking about. We had a very successful orientation period over 2 weeks. That was a collaborative between all of our programs and many of the departments here in the hospital, and we had a lot of participation there to be able to introduce them to what we do here at JPS. So we're very pleased. We also have our students coming through following suit. We're also in the middle of our annual program evaluations right now for our programs. Each program is charged annually to review their programs, and they're currently in that process, and we look forward to having those reports by the end of the month so that we can collectively discuss them in our future GMAC meetings, and then be able to produce an annual institutional review here for the board in the next couple months. And also with that, the ACGME, our accreditation body, has also opened up their annual accreditation period, which is from July 5th to August 31st for each of our programs. So they're also actively engaged in the annual accreditation process where they have to do the reporting to be able to do our continued accreditation, which we've been successful in doing to this date. And then we also have within ACGME, we're doing our institutional updates too, and doing that report for the ACGME. We have also coming up in our GMEC meetings, we look forward to reviewing our ACGME faculty surveys and resident surveys. The residents are surveyed annually by the ACGME, and the faculty are also surveyed annually. So we get that collective report, and each program gets their report that they're reviewing right now during their annual program eval. But we'll also be able to look at that collectively and look at areas for improvement. One of the areas that shines that we're looking forward to is kind of working on our scholarship and other things that we're doing here and working with our research departments here in the institution. So we'll have more to report on that. We're still awaiting word on our clinical learning environment review visit from the ACGME. They give us about 10 days or 2 weeks notice before they will let us know. So we'll hopefully probably hear from them in the fall, and they'll come by and give us a review of how we're doing with our clinical learning environment. Other than that, we're excited. We've got a couple of our programs that are opening up now for their recruitments. Our fellowship programs have opened up their recruitment, and so they'll start interviewing applicants in the near future, and then we'll open up for the rest of our programs in the fall. So thank you for the opportunity.
Thank you. Next is the information technology report. Melinda? So just briefly what we talked about at the MedExec. I'm sorry, I thought I warned you ahead of time, my mistake.
No, delighted. And actually, I sent my time at that particular meeting over to Dr. Niakiris, and I'm happy to have him talk as well. But we talked, we talked specifically about mobile device management, which is, of course, carrying all the information that you do on your phones, and having the physicians find a good, convenient way for us to meet all our HIPAA requirements and security requirements for that meet some issues that Ron has and some that we have, but finding the most appropriate way to do that that's convenient for our physicians. Do you want to add anything to that, Dr. Niakiris?
Yeah, that was the main thing I wanted to emphasize is, because we talked about at the Board of Managers about protection with the different devices, and so I wanted you guys to share the comments that you had.
Say things briefly, because I believe I'm up next anyway.
Yeah.
So one of the things that we've been working at strategically with the Information Technology Department is to form a collaboration with the medical staff. As you can imagine, it can be difficult as a physician to be told what we have to do with our own personal devices. What we have done is readdress with the medical staff the importance of having protection on our mobile device, not only to the district, but to the individual providers. And through this collaboration, rather than just telling people you have to use certain device security or not, we've created a lot of options. And these various options will protect the district and the individual providers. And we'll be happy, I'm happy to say that as of October 1st, everybody will be 100% compliant with our new security restrictions. And so pleased to report that to the board.
All right, since you're there, the Medical Records Committee, this is the one that we're very proud of. We've made tremendous strides thanks to Dr. Niakiris.
Well, I'll comment on the thanks to that in a second. I'm pleased to present the work that the Medical Records Committee has done over the past year. At about the last time we had this joint meeting, we had some significant difficulties. Difficulties that were infecting revenue cycle and actually our income to the hospital. There was documentation that was incomplete, and incomplete so long that we could no longer bill for the work that was done for our patients. We identified this as a significant risk for our district, and we put in place a data-based set of policies and procedures, and also interacted with the medical staff to re-educate them on the importance of document completion, not only to patient care, but also to the financial health of the district. So I gave you a little handout to see what we've accomplished on the outpatient side. of our records, which we identified as the biggest financial risk to our to our district. What you can see if you look back at July of 2016 is the yellow is really a heightened area of risk. That's medical records that are delinquent and approaching the 90-day threshold for which they become potentially unbillable to payers. And what you can see is we started with over 500 records, and it was actually more than that before this process went into place, that were effectively being unbilled. Within a matter of 1 month of putting in place our new process, we reduced that risk by 80%. And our data is actually so sensitive and specific. If you look around the October timeframe, you see a little bump up in the delinquencies. That's because we temporarily suspended the process for new providers being brought on from a claim that had no experience with Epic. We didn't want to overly stress them during the transition. So we put a temporary suspension. As you can see, the delinquency rate rose. Then we flipped the switch and made everybody the same, and you see that we've dropped to a sustainable process. I'm proud to report that we almost have zero problem with unbillable records from the outpatient side, which is a tremendous financial benefit to the district and a patient care benefit to those we serve. Also, proud to announce that we just began our inpatient process that's similar to this. It started on Monday, which was the 1-year anniversary of our outpatient process, and within 3 days, we've reduced our our inpatient delinquencies by 65%. 3 days of a new process. So accountability works, but it's accountability with partnership with the medical staff. We managed to do this without having so much as a complaint. And I think that is a testimony to the collaboration. And I would like to point out that this, I appreciate Dr. Ziegler's recognition, but realistically, this could not have been done by any individual. This was a partnership and a collaboration between the Medical Record Committee and everybody on that committee, the HIM department, and the leadership in that department, as well as the IT department, to help provide us the analytics and data we needed to do this. So thank you for allowing me to give this report.
Thank you, Tim. Yes, sure.
If you were able to reduce the delinquent billing, how does that reflect ability to collect?
I'm sorry, Reverend Emerson?
You were able to reduce the billing.
Oh, no. So, I'm sorry. So what this is we are looking at incomplete documentation. So without the documentation being complete within our specified time period, those that submit the bills on our behalf can't bill them because there's not enough documentation to support the billing. And so that was our risk. And through a process where we had data to allow for accountability of completing documentation records on time, those bills were then able to be submitted, and therefore we were able to obtain revenue on those collections.
Yeah, that's what I'm asking. What is that? What is the ratio of collecting payment?
Sir, you have exceeded my expertise, and I would have to defer that to someone else.
All I know is when you asked that question to Dr. Nakaris, everybody else's face changed on the medical side. Oh, he's asking questions. So everybody's face changed.
Well, how do we find that out, though? How do we?
We can find that out from the finance.
Yeah, I was gonna say,
Yeah. We could always ask. We could ask Melinda.
Billing's gonna go up, revenue's gonna go up.
Medical Capital Committee did not meet, but that's a committee where if somebody has some new technology that they want to bring to JPS, then that committee meets and we look at how much it's going to cost and whether it's something that we need to have here. And then it goes from there, and Bill Whitman brings it to the Finance Committee, I believe, the next step. Bylaws, we've been working on those, but we did not meet last month. That's by Dr. Sneederjohn. I don't see Dr. Sneederjohn here. Patient safety and quality governance. So Dr. Webb?
Yes, thank you. So we are a multidisciplinary committee that takes a proactive approach to patient safety and quality. And the committee is made up of a lot of the people that are here in the room today. It's the medical chairs, it's leaders in ancillary services, nursing, administration, and executive roles. And we also have a patient advisor. That's a patient here at JPS that sits on our committee with us also. And that helps increase transparency and patient involvement. This committee provides leadership and oversight in support of the QAPI program, which you all have recently passed in the past year. And we receive analysis and take appropriate actions on reports from 18 subcommittees. So I won't bore you on all the subcommittees, but some of the main subcommittees that we take reports on are the P&T Committee, the Infection Control Committee, Emergency Management, the Multidisciplinary Review Committee, and the Order Set Committee, just to name a few of those committees. Our main functions also, we want to focus on the efforts of increasing psychological safety here at the hospital, preventing patient harm. We also want to, we also look at the serious safety events, and improvement efforts are discussed in a dyad relationship, again, with administration, nursing, and physicians. We discuss publicly reported data that you also hear here at your meetings. We talk about the CMS hospital star rating, the AHRQ patient safety culture survey results, and then the Leapfrog hospital safety survey. So we get those results also and talk about that amongst the medical staff. Some of our actions to date in the past year, we do give recognition for efforts to create a safe environment of patients at JPS, including the I Own It and the Good Catch awards that you sometimes hear about. We've had consistent attendance from our medical staff department chairs, and that's helped promote physician engagement at an organizational level. We formally recognize the Antimicrobial Utilization Committee, which is a joint commission requirement. We've also looked at the safety culture survey results from the 2017 JPS AHRQ, and those results were presented to you, I believe it was last month in our in this smaller group committee meeting. We've also discussed and approved policies and procedures to improve patient safety and quality. Example of that would be using disposable laryngoscopes in the hospital. We've also had the discussion of our preoperative huddle and other organizational performance improvement initiatives. And we also do discuss monthly on a rotating basis the QAPI reports from the hospital on a rotating basis. And just to remind you, there's about 20 of those, but some of the main ones that we've received lately are contract services, human resources, infection prevention surveillance, lab, sepsis, disease-specific certifications such as stroke, utilization review, and also our trauma program. So we do get a lot of reports back from a lot of the different committees, and this committee does oversee multiple committees in the hospital. So, thank you.
Thank you, Brian. Did you want to mention about the huddle? We did, okay.
I did mention that, and I brought that to the quality committee probably 6 months ago or so, how we were doing that. And we did pass in medical executive, that's going to become the standard here at the hospital, and we're working on that through all the different departments to make sure the best way to get that implemented in each department.
Yes.
Dr. Ziegler, I just need a little clarification. I'm under the care of Dr. Webb, and when I came in, he asked how I was doing with my arm that he's been handling, and there's been a lot of discussion of revenue. Is that considered an office visit? Am I going to get that? Because I do get my bills. I do get my bills and the insurance that we pay it, but I was just curious if today was a, but anyway.
Depends if you kept your jacket on or not.
But the new
Point,
policy,
only if the documentation's right.
the documentation's already delinquent as a new policy.
That's right.
He's the one that raised the issue.
Next, we have patient satisfaction, the HCAHPS, and Laura Burnside will give a little presentation of what we talk about.
Hello, everyone. So I am actually very pleased to say that Dr. Ziegler invited us to join MEC toward the beginning of this year, actually. And so we have the opportunity every month to talk about the overall rating of the hospital as well as the specific physician dimensions. And so what that means in my world is that we actually measure the perception of the patient about how well the physician listened, explained things in a way that the patient could understand, and treated the patient with courtesy and respect. So we look at that data and in those graphs every month and see where we are. what opportunities we have to improve. And then the beautiful part about this is that we've been able to form partnerships with the physicians in a way that we have not been able to do in the past. And so we're very pleased about that, and I thank you for that opportunity. It means a lot to our organization, and it means a lot to us as patient experience people to be able to partner with physicians. So we're very, very pleased about that. Additionally, I mentioned at the quality board meeting a couple of months ago, so not this past one, but the one before, that we have just been selected for a physician project across the country. And that's another way that we can partner with our physician group in a way that manages the work that's happening and improves the well-being of the physicians. Many of the doctors in this room are part of that group as champions, and so I thank all of them, as well as you, for being able to allow us to participate in that manner as well. Are there any questions?
Thank you, Laura.
Okay, thank you.
Yeah, we look at, one is physician communication on the different floors. Some are outstanding, as I think Ralph asked one time why they aren't all the same, and it's because each floor is a little bit different. 2 South and 2 North are outstanding. They're in the top of the country. But they're taking care of mothers-to-be or women that have just had babies, and they have strong family support. Most of them have insurance, and so trying to compare them to one of the other floors where a lot of times we're dealing with patients that are recovering from a severe illness or major trauma or major surgery. A lot of times they don't have family support, a lot of times they don't have insurance, and trying to get the same satisfaction scores from them as to 2 South and 2 North, it's just a different population. But we do look at, is there good communication, what can we do to make it as best as possible? All right, PEC, Physician Excellence Committee. So mostly this is Jocelyn, she does an outstanding job. It is of all the committees, this one it's a huge task, and I am greatly appreciative of the job that she does.
Thank you, Dr. Ziegler, and thanks for coming to our meetings too, because you can see all the work that is put into that. So what we presented yesterday is just kind of our monthly report, our standing report. But what PEC is the Physician Excellence Committee, and it was established to create a culture of positive feedback, timely for the physicians. And we do identify certain issues and areas of quality that are concerning or might not be concerning. We have an extremely helpful staff. We have 4 quality nurses that screen about 100 to 200 cases a month to bring to the actual committee. The committee is made up of 13 members. 8 of them are from actual departments. The general surgery we have to have every month, and then there are some ad hoc members that get joined, or someone that we think, like pathology, that gets added. The committee members serve 3-year terms, and we meet every month for about 3 hours to discuss those 10 to 20 cases that the nurses screened that felt need actual physician review. And during that time, we kind of get through discussion, and it's because it's multidisciplinary, it kind of adds everyone's perspective into how we feel the quality of care was being delivered. And within that, if there are points of excellence or good catches, we actually also came up with an award recently called the Strong Work Award. So that way, not only there are opportunities for physicians to receive feedback about their care, also try to identify those that have had patient compliments or other areas that were of note. So that's kind of what we do.
So we do look at quality issues with providers. Mostly what we're looking for, are there anything system that needs to be improved, whether with pharmacy or radiology, but we do look at also with physicians. And if there seems to be a pattern, then we have to bring it to we have to take the proper steps. One of the things that Mr. Early mentioned that we presented some things at quality, but they were, by the time they get to quality, they've gone through several other committees, and so Mr. Early mentioned how things don't seem to be timely, but they're they have to go through a process. And so by the time it comes to the Board of Managers, it's been through a long process. And hopefully by the time it gets to the Board of Managers, it's got the final stages of the review, the monitoring that we do. Thank you, Jocelyn. All right, Patient Satisfaction Committee. Practitioner Satisfaction Committee.
Hi, I just want to thank the board for letting us come and share this. I'm the chair of the Practitioner Satisfaction Committee, and so we really serve as a voice and a work group for all of our different practitioners across the hospital to keep them happy, to address any issues. We know that happy providers lead to happy patients. And so this year specifically, we've teamed up with Dr. Ziegler and the administration to address any issues that came out from the practitioner engagement survey. So we actually got data on these are the issues that our JPS practitioners are concerned about, and we now as a committee have been empowered and really enabled to address those issues. So a couple projects that we're working on is we are starting a new provider orientation to really make sure that from day one, that if you join the JPS medical staff, that you are going to be understanding of what our culture is, what's expected of you, and how we want you to take care of our patients, really from day one. The other two large topics that we're addressing are ways to improve communication amongst the medical staff, as well as how do we really recognize those excellent providers. We also have a focus on wellness as well, because again, if you have a wellness focus for your practitioners, it's really going to lead to better patient care. Any questions for me? I think I'm everyone's favorite. Am I last?
What's
Not
that?
quite. I'm close to last, I know in the meeting,
Yes,
so usually I'm everyone's
Yeah.
favorite.
We did have a town hall meeting last month that I thought was very productive, discussing a lot of issues. One is to improve physician communication. I do want to address now with the claim. And I think there's some confusion what's the difference between the medical staff and a claim. And there are certain things that the medical staff they have a responsibility for example, Dr. Schrader's committee, the credentialing committee. That will stay within medical staff. But when we get to things like quality and accountability, the borderline kind of is a little vague. And I was very glad that Dr. Johnson came to the meeting. He came there as a medical staff, but I kind of put him on the spot, and he did a very nice job of explaining, what the role of a claim is. And I think this is something that is in the process of development, not only here at JPS, but I think nationally, the way things are changing, that this is something that there's going to have to be some understanding, some blending of a claim and the medical staff. The other thing that they talked about, there was one thing we talked about was some of the physicians come in late at night and can't get a proper parking place. And one of the requests was taking the Board of Managers parking place. And I said, that's off the table. You can have Mr. Early's, but they can't have the Board of Managers. I don't think they realize the work that, they were under the impression that you only come in once a month. And I said, no, that's far from the truth, that you're here a lot more than once a month. Yeah. And with that, then we went into our closed session, which you will hear about during our closed session, this meeting today. Any questions, comments?
Dr. Ziegler?
Yes.
I've heard quality mentioned so many times, and I'm sort of about to take that personal. I'm Roy Lowry, I'm the chair of quality. What I want communicated to the medical staff is the quality committee here is an open door or a telephone call away. I agree with Mr. Early stressing to you guys that information early is wanted and sought after. So we're here, and you can take my parking place, and that's okay. But quality is moving forward, and we want to network better than we ever have. Not criticizing from before, but we need to be better, and that's my goal. Thank you.
One thing, we do need to try to get things done in a timely fashion, and we are certainly working on that, that things get, that they don't sit in committees for a prolonged period of time, that they do get moved forward in a timely fashion. All right, thank you very much. And with that, I'll turn it back over to Charlie.
Thank you very much. I just read it, gave you, looked over there at your side. All right, I believe that. And again, to all the outstanding physicians we have in this room and throughout this entire hospital, I make this comment on behalf of this board. We appreciate what you do each and every day in the mission of this hospital. So I'd be remiss not to say that right now. And so, because I know as we go through this, we're going to get back into some business. But thank y'all for what y'all do, not only you, but the rest of your fellow teammates, part of the JPS Physician Network. So thank you very much. And while we're on the subject of physicians, Dr. Johnson, would you please come up under item number 7 with your report? Thank you this morning.
Yes, sir. Thank you, Mr. Powell. If you would permit me just a quick comment as it relates to the medical staff.
Certainly.
As many of you noticed, because I know you've sat on this board for a number of years, there are a lot of new faces talking this year, aren't there? There's a lot of new folks. Behind me are a group of, and in front of me, Dr. Schrader and Dr. Ziegler, are the most remarkable group of physician leaders I've ever worked with. Today, just hearing those reports, having sat at this combined meeting for 7 years, there is a palpable sense of collaboration, to Dr. Lowry's comments, between the board, between administration, and between these physicians. And so congratulations to you and you guys. And I've never been more proud to be a member of this medical staff. With that said, a quick update on a claim. Chair selections continue to go well. We've completed the process for 4 out of 5 candidates, and we do expect a couple of additional announcements within the next week or so. We continue to work with medical staff leadership, Dr. Ziegler, Dr. Schrader, Dr. Luke behind me on practitioner satisfaction, Dr. Elliott at DIO and representing the residents. Frank Rosinia gathers us all in his office, and under the strategic guidance of Marianne Roth, we address physician burnout and physician well-being and physician satisfaction in an extremely collaborative way. We're making a lot of traction to that end. Compensation plan for a claim, we've discussed early on and continue to discuss an RVU-based or production-based and quality-based plan. We are moving into that by January 1st, and I'm happy to report that as of now, we offered our physicians the opportunity to opt into that, put their production at risk for compensation, and nearly half of the group has already signed the contract amendment to move into that plan. So remarkable participation there. They all will move in, as I said, by January 1st of 2018. Recruitment is also improved. We have 2 wonderful recruiters who are new in their role here, Lynn Newsom and Crystal Hernandez. We are down to about 33 open positions. All but about 5 or 6 of those are have identified candidates, are in the process of scheduling interviews, all the way to working through signing a contract. After the contract, as you can imagine, there is a pipeline to that end. I did notice on our latest report as of this week, in the pipeline, we will start 12 in July. We have 5 in the pipeline to start in August and 4 in September. So things are moving well there. Any questions? Yes, sir.
I just wanted to say thank you for the invitation for board members to serve on the interview panels. For me personally, it was a learning experience. I got to meet some physicians I didn't know, but it was good to hear what outside individuals thought and saw about JPS compared to what the inside saw and thought about JPS. But I just want to say it was a plus. I really enjoyed that.
Thank you, Reverend Emerson. I would also say thanks back to you and all of you that participated in those selection committees, because we also learned a lot from you. There's a lot of experience here. We were able to recalibrate many things in terms of how do we evaluate ourselves as leaders, how do we improve our selection process for leaders based on your experience, and we appreciate what you gave to that group just as much. Thank you, Dr. Lowry, Mr. Bowes, all of you. Dr. Weber.
Good point, Ralph. Thank you for everybody's service. Thank you.
That does conclude my report, unless there are any other questions.
Any other questions, Dr. Johnson? If not, thank you so very much.
Mr. Chairman, if you would, I know that, and I'm very appreciative, Dr. Ziegler, of the reports and coming before us and the working relationship that we have with the physicians. And I know some of the reports, and you may have introduced some of them, but I know a couple came in late because we also have Dr. Gandhi here, and we have Dr. Cepeda here. We have Dr. Kaiser here.
Well, just introduce who does what here.
Yeah, if you want,
With the-
yeah, because I want to make sure that everybody got recognized, and I didn't want them to, in our haste or anything else, miss those.
Committee work, but Dr. Lucas works for is one of the emergency physicians. Dr. Spada is one of the hospitalists, and he is the head of our multidisciplinary committee. Review committee. That's a committee that we do during a closed session. Dr. Neil Karras is with the orthopedic department, one of the hand surgeons. Dr. Manoff is the chair of the Department of Internal Medicine. Dr. Fromm, as you know, was recently selected as the chairman of the Department of Anesthesiology. Dr. Elliott, Dr. Kaiser is the chairman of the Department of Radiology. Dr. Gandhi is our director of trauma and one of our surgeons. Dr. McReynolds is our chairman of the Department of Surgery. Dr. Z works in the ICU. It's very hard working with Dr. Z because they call me Dr. Z and they call her Dr. Z. We have an emergency, Dr. Z, and then we run into each other trying to get to the emergency. Dr. Webb is the interim chairman of the Department of Orthopedics.
He's actually chair now. Not everyone anymore.
My bill went up.
And Dr. Casey, what is your, I guess you're the program director of the Department of Family Medicine. And am I missing anyone else? And then, well, Dr. Schrader.
Dr. Schrader.
In the emergency department and our vice president of the medical staff.
Good. All right. Well, again, thank each and every one of you for being here. So I'll move along to item number 8 on the agenda. It is a report from the Citizens Blue Ribbon Committee. I'm happy to say that we have 2 individuals who serve as our liaison members to that committee, Dr. Roy Lowry and Mr. Trent Petty. They attend a lot of meetings there also, which we're very appreciative of. This last Tuesday, I think it was kind of a special time for that group. I think, Trent, I'm going to turn over to you because I know a presentation was made, so
sure.
The floor is yours.
We won't take long and belabor this, but again, Dr. Lowry and I have had the pleasure of serving on this committee, and as chair of planning, I was asked to give a bit of a summary of the JPS board and staff effort since 2009 relative to the facilities planning, and we're able to do that, and I think the Blue Ribbon Committee had actually requested that the board make a presentation so that they could be comfortable that the recommendations of the consultants were aligned with what the board had to work through, and I think they were very pleased with the efforts that the board has made. We made it very clear that these studies have resulted in, frankly, a very lockstep agreement, and there's virtually no conflict between what this Blue Ribbon Committee has come up with versus what the board came up with. So it was very positive. We ended up with very high recommendations on all the projects. I don't think there's any reservations about moving forward, and it was a pleasure to be a part of it. It was an honor to be able to represent JPS in that capacity, and I'll yield the rest of my time with Dr. Lowry.
Sounds good to me.
Mr. Chairman, I would tell you that for those of you as board members, the work that Dr. Lowry has done and Mr. Petty has done has been amazing, because you all know that we as a board and we as administration are support to the Blue Ribbon Committee for information they want. We're not trying to guide it. We're not trying to steer it. As Mr. Petty mentioned, it is an evaluation of what we've done over the past 7 years, and there hasn't been conflict to that. I do think, although I don't know that he would appreciate it, but I will call it out, Mr. Petty, in conjunction with Dr. Lowry, made a presentation, and in that, staff gathered a great deal of information, but oftentimes what Mr. Petty would say when we were discussing the presentation is, I want to make sure that I truly represent the board, and I want to truly represent what's taken place in the last 7 to 8 years from the board. And I think you board members need to understand that you had an incredibly great representative who was conscientious at every statement that he made, that it was truly factual and truly representative of this board. And I think you and Dr. Larry did an excellent job, and I've heard nothing but the professionalism and the passion at which that was delivered, and I appreciate it immensely.
Thanks, sir. I will tell you, it's hard to go wrong with good material. Scott and Diana, that group put together, Sharon, everybody put a lot of work to make that presentation, so we appreciate it.
Well, I'll take a personal moment here just to say ditto to what Robert just said. Robert and I do not attend the Blue Ribbon Committee for the purpose of, we have two very highly qualified individuals that represent this board as our liaison. But as everyone knows, it is open to the public. I was out of town. I spoke with Trent. Trent immediately took no credit. Roy doesn't take any credit for the work. I know how many Tuesday afternoons they give up. I see the schedule. It's public record. They also make all the meetings here. You heard Roy earlier. He chairs quality. Trent chairs planning. So what made that presentation easy, he takes no credit for it, and he had to be the one to verbalize it. But Trent spoke from his heart, and that had a whole lot to do with the numbers. And he was also quick to point out that the numbers provided by the staff, by Diana, Scott, and everyone else, certainly those numbers were very, very important. I appreciate the staff's work. But again, Trent, thanks very much for your commitment over the years to this institution. Roy's yours likewise. And again, I think it does fall in line with what not only going back to whether it's your chairmanship, back to Steve Montgomery's chairmanship, to Ralph's chairmanship, at the end of the day, it just continues for us. So thank you very much for your work on that. Is there any questions for Trent relative to, it's really not an action item. We just want to make sure, since that was just done this past Tuesday, that we presented that at least the board was aware. Many of you may have watched it streamed or whatever, but we want you to be aware of it. So Trent, again, thank you to you and Roy.
Mr.
Yes,
Chairman, I think one of the pluses and highlights when you look at the entire process from the original beginning 7 years ago, the master plan, to what the consultant group put together, to where the Blue Ribbon Committee is, it has all been consistent to what JPS has stated its needs are.
Right.
And so as we go forward in closely approaching the bond vote, is not helter-skelter, that what we've said and what has been presented at community forums, it's still consistent. It's not out of whack, and I think that's a plus.
I think your point's well made, Ralph. And again, it's not just, again, I have the pleasure only for the time sitting in this chair, many said here before, it's just a continuation of that process. And I think we're now getting to the reality. And again, thanks to not only the people involved now, there's been a whole lot come before us. And for the time and energy you and others are giving to this board, I say thank you very much. So,
Mr. Chair,
yes,
if I
ma'am.
could, I want to thank, I know we're into thanking, but Scott Rule and Mary Ann Roth have worked diligently with GK Manius' staff, and GK Manius' staff has done admirable work, but Mary Ann and Scott attend all those meetings and provide all the background documentation and research for that, and that's a lot of heavy lifting, and I appreciate both Scott and Mary Ann very much for all they do.
We get to see Scott a lot because he sits right there. Marianne, would you stand up in the back? We'd like to recognize you both. Scott, y'all stand up. Again, Trent, thank you. I guess at this point in time, I guess, Dan, I'll come back to you. As we're fixing to get into just some of the board stuff, if you want to adjourn yours at this time, if someone wants to leave, you're welcome to stay, whatever y'all would like to do. Officially, I guess as part of that bylaws, that meeting is kind of over, but y'all are certainly welcome to stay. But if people hate to stop all the positions if they've got something else they want to do. So I'll turn it over to you.
Thank you all for coming. You're welcome to stay.
Right. Super. Again, thank y'all very much. Thank y'all so very much. Thank y'all again. All right. Then we'll get kind of back to our ongoing line items on the agenda, which will take us to item number 10, which is the approval of the minutes. The June 8 minutes have been attached. They're on the portal. You probably all read them. If there is no recommended changes, I would certainly entertain a motion for approval.
Move to approve.
I have a motion by Mr. Fisher, second by Mr. Wynn. All those in favor say aye. Thank you so very much. We will then get to our committee reports. Finance Committee, it's a little time differential. I communicated with Chairman Montgomery, who's in California this morning, and he'd sent me some emails. And so he said there was nothing unusual in finance this past time. But Sharon, I know you're here to give us our financial reports. Anything else or any questions we may have relative to finance. So if you'd come forward, good morning, or good afternoon. Thank you. Yes.
I've got one here.
Oh,
Thank you.
okay.
That's all right. These are nice and low. So for the month of May, I'm going to cover these at a very high level. We covered these in detail at Finance a couple of weeks ago. If you recall, the hospital did have a loss of $961,000 for the month. Although the outpatient volumes were very strong, we did have two large reasons for some extraordinary operating expenses. The first one was in our employee benefits category. We did have some large claims come through during the month of May, and also in purchase services. Some of that outpatient volume was in our psychiatric emergency department. When that happens, we have to offload some of that volume into our community partners, and our outpatient, our outside medical services were extremely high in our purchase service expenses. So that cost us almost $1 million for the month. So the medical center expenses were extremely high due to those two items for the month of May. Also for the month of June, just to prepare you, those expenses did continue into the month of June as well. So those continued through. Also, the acclaim expenses, you'll see there, we had a loss in a claim of just over $1 million. That trend, that's about where a claim has trended for the last several months. We did have some open position. Volumes are lower due to some of those open positions. And that puts our combined operating loss for the month at just like right at $1.9 million. Are there any questions for the month of May? Again, we had some extraordinary operating expenses that did hit us for the month of May. The psychiatry expenses? Yes, it goes back to when we have really high psychiatric ED expense volumes. We just have so much capacity in the psychiatric ED. And then when we get our inpatient beds full, we have to offload that ED volume. So we have 4 community partners, and if they are self-pay or our connection patients, we do have to, we have these agreements which have come through the Finance Committee, and we pay for those patients to go inpatient at one of those 4 facilities if the JPS beds are full. And that came through our purchase service expense.
Now, we have a sizable, lengthy wait on these services, do we not?
Well, you can't wait for services if patients enter through the emergency department.
Right, basic triage, right, here, who can go home and who gets to stay.
Correct. And in the emergency department, there is a large percentage, probably over half of those patients are actually brought in by emergency services, so police departments and ambulance. So, you know, that it's not as if you can just ask those patients to go home. They have to be dealt with and put in a safe environment.
We talked about this once, I think, we said we had to reserve a section of it for that. Is that what we do?
Well, you can't reserve, if our beds are full, if we have capacity, then obviously those patients are put into an inpatient status here at JPS. But if our beds are full here at JPS, then we have to find places for those patients to be offloaded from the psych ED.
I guess where I'm going is there are non-emergency patients, right? And there are emergency patients.
Yes.
If we take all comers and we fill up all of our beds because we have capacity, and then almost by definition, anybody who comes in by emergency is going to have to be offloaded to one of our partners.
Yes.
So it seems like we ought to, if we can schedule or figure out, well, we expect to get so many emergencies. You know, last year we got this many, next year we expect to get this many. So we don't fill up on the non-emergency, and we ask those folks to hold off, or do we do that?
Again, by definition, we don't admit someone that doesn't require admission. So, Wayne's coming up. Thank you. Hello, my friend.
It seemed a little lonely.
It's always lonely at the table. That's what I tell all my friends that sit back in the back. But yeah, it's not, and Wayne can address this better, but those beds, we don't hold beds, but yes, we do our best to try to schedule where we're not having to pay outside medical services.
So, if I can, so unlike acute med surg beds, when you admit someone into a psychiatric bed, by the definition, they're an emergent. So you don't have planned admissions for psychiatric care in most cases. So everyone who's admitted meets the threshold of either being a danger to themselves or a danger to someone else. Almost just over 80% of the volume of the people who we admit to our inpatient services are there involuntarily. It means a judge has committed them to inpatient care. So the judge has said, despite your protest, despite your right to civil liberty, we believe that you meet criteria to be here involuntarily.
Okay, so the point is that psych beds are all emergency.
Yes, sir,
in a way
they are.
that
They
most
are.
other areas are not.
Yes, sir, exactly. So we do fill ours up first. That is the priority before we would ever send a patient outside. In fact, I'm the only one in our system who has the authority within behavioral health to approve a patient being transferred on that contract. And so literally all weekend long, they will contact me requesting contract approval for transfers to other facilities. And that's only done, we actually have a saturation plan that goes through different levels of saturation. And the very last column, on the very last row, is contact Wayne for approval to use outside facilities. So it is literally the last resort that we use whenever it comes time to try and find a bed for a patient who needs inpatient services and we don't have the capacity.
Thank you.
And Warren, just to clarify, some of the stuff that came out of the data that was gathered for this, for the Blue Ribbon Committee, they talk about the fraction of indigent care, uninsured care that's taken care of by JPS. They didn't really separate out psychiatry, but I'm going to tell you, as a physician, on specialty services, there are hospitals that go on divert. We're at capacity, we can't take another patient. I may be wrong, Wayne, but I don't know that JPS has ever declared themselves on divert for psychiatric situations, correct?
That's correct.
So we're providing a service here, thank you very much, an uncompensated, and you want to hear squawking, raised to the 39 private hospitals that were discussed in our study. I know this is going out all over the county today, that they need to take their share of psychiatric stuff. It'll get real quiet. You'll hear crickets all over town. So we are, some of our data was skewed because it said we only take care of 26% of what ought to be our available population. I would venture that in psychiatry alone, we hit more like 75%. Fair guess, Wayne?
Probably so, especially when you consider those purchase beds that we end up buying.
And Warren, we are planning, Wayne and I have had several discussions, formal discussions about what can we do to try to plan or try to put some strategy around dealing with patients before they're in the crisis and end up in our emergency department. How do you deal with them in a primary care or even intensive outpatient to where you're not having to pay for an inpatient setting and deal with that capacity? I mean, that's what he does every day, but you know, it's not, we're not just sitting waiting for him to come. It's just, you know, we have not dealt with the high utilization that we have seen in May and June in the outpatient setting that created some of these diversions that we had to access for psychiatry in May.
My ongoing issue with the psych world, and for a number of other things that we provide, is that we have this balancing act of, we don't want to say we're going to deliberately give less available services to drive people away. At the same time, if you say, if you're feeling bad, come on in, we've got capacity, and we make it easy to get in, well, we're always going to be at capacity. It doesn't matter how many beds you add, we're always going to be at capacity because it's easy to get in, and taxpayers are paying for it. You get 3 squares and a dry meal, I mean, a dry roof. And I don't want to be callous about it, but on the other hand, there is an issue with, if we are so welcoming to the point where people would rather, I'll just go stay at JPS because it's easy to get in and they have space for me, we're never going to never have space for the real issues. I'd like to see a breakdown, actually, of how many judges are signing, how many folks we're housing based on judicial order versus a medical diagnosis of some sort. That kind of, has that been done?
So all of the involuntary patients or committed patients are typically within Trinity Springs. And so they are about 80% of the volume that we admit to Trinity Springs are involuntary. So of the roughly 4,000 admissions in a year, about 3,200 of them are initiated via law enforcement. Now, there is an entire process, and I would welcome you to come and take a look and see some of our services. It's probably not a place where you go for relaxation and regroup.
Right.
It doesn't have that feel to it. But it'll help give you a sense of the level of acuity, because the threshold to be admitted to any inpatient psychiatric facility is pretty high. I would say to a county tax-supported system, that threshold is probably even higher. And so there are really fairly acutely ill individuals who are being hospitalized. There's not a lot of worried well individuals that are going to try and make it into that setting. And we have doctors who their whole job is to try and help us manage this flow and process, and they're very good at it. We have one of the few teams of emergency psychiatric physicians in the country, and they're excellent at what they do in terms of figuring out who needs admission and who doesn't. But the involuntary process, it starts off with actually not a judge, but a peace officer initiates detention. Doctors can't initiate detention in Texas, only police officers and judges. So a police officer encounters an individual on the streets or in a community, determines that they're a danger to themselves or others. That's the only criteria that's eligible. Or the third one is if they were unsafe to remain in the community and likely to have serious consequences from that. And then it comes to us, and then the doctor has to evaluate them and determine that they are a danger to themselves, continue to be, and it's because of a psychiatric condition. And then 2 physicians have to submit a filing, and it goes to the probate judges. So probate court 1 and 2 are the judges the associate judges are the judges who do that.
And I do want to know all these things, but I think I'm taking up a lot of time here, and I didn't really intend to do that. Let's just talk afterward.
I'd be happy to do that for you, sir.
Yeah, thank you.
Wayne, I don't know if your budget changes, but on behalf of your CFO, thank you for coming forward.
I'm playing all the angles I can, sir.
You've helped your cause.
And Wayne, I appreciate your comments to Warren's. I was going to say, spend some time in Trinity Springs when you were talking about that feel good. But again, any other follow-up you want to do, Warren, feel free to call Wayne.
Were there any other
Other
questions for May? All right.
All right. Sharon, thank you very much.
You bet.
And I know you're busy in the budget process and doing all that, so
Oh,
I
yes.
know that's going to be coming to finance, and this board will be seeing all that here in over the period of the next few weeks. So thank you very much, Sharon. Next item of business is the governance Mr. Fisher.
Thank you, Mr. Chairman. I want to give a special thanks to the JPS culinary team as well as Ron Skillens for actually helping us get a quorum at governance with their cookies and Ron's key compliance headline updates. So that's always good, and also happy to hear from the Medical Exec Committee that the mobile device manager situation, which presented a significant risk to the hospital system, will be under control. That's really good news. Our meeting on the 22nd, we just had a quick update on the internal audit process, and then had several closed items which are available on the portal.
All right. Any questions for Roger? If not, Dr. Lowry, you mentioned quality earlier.
Mr. Chairman, quality met approximately 1 week ago. We had a reasonable meeting with a variety of items. One item for sure will be discussed today in close.
Okay. Any other questions for Roy at this time? If not, thank you very much. Do we need a motion for all of those, or just we'll accept them as presented? They're accepted as presented. Thank you very much. Item number 12. Oh, excuse me, Trent. You'd already spoken. I was going to.
I did. I took care of everything.
No, is there
earlier.
anything else was
Other
discussed?
other than our report for our capital and the thanks for the work regarding the groundbreaking, we have one item that'll be closed also.
Great. Trent, thank you very much, as always. Item number 12A. Consider approval of amendment number 1. I'll call upon Sharon to come back to that. Please, ma'am.
Sorry,
Welcome
I forgot
back.
I was back up.
Welcome back.
Thank you. Okay. This is for another, just an amendment for Superior Health Plan. This will allow us to clear up some language on the contract, if you would allow us approval for this contract. This is amendment number 1 between Superior Health Plan and the district.
Any questions for Sharon relative to this contract, this First Amendment? If not, I'd entertain a motion. I have a motion by Dr. Weber, second by Mr. Wynn. All those in favor say aye. Aye. Sharon, thank you very, very much.
Thank you.
Anything else? Item number 12B may come back and be considered after close, which would take us to item number 13, which is the consent agenda. If there's any questions, be glad to acknowledge those. If not, we'd recommend a motion for approval. I have a motion by Dr. Weber, second by Mr. Boast. All those in favor say aye. Thank you so very much. Which takes us down to item number 14, which is the general counsel legal. I know there was a lengthy set of agreements and attachments and addendums that was on the portal. So we will deal with item number 14.
Mr. Chairman, on item number 14, I am asking if we could move this to close for discussion first on the engagement letter between the hospital district and Adams, Lynch, and Lofton.
Is there any other discussion relative? Should this go to closed, or?
Mr. Chairman, I make a motion we approve it in open session as stated and reviewed.
I'll second.
Since it's been moved in second, I assume that the votes are there to move it, to discuss it, then I'd like to discuss it in open. I have concerns in reference to this letter of engagement between legal counsel and JPS. I've raised the issue on several occasions over a 9-year span because it does not address the diversity policy as it pertains to JPS. Each year, a commitment has been made that it will be addressed, and it has not been addressed. I have a problem with how we are approving a letter of engagement for legal counsel to and that same legal counsel looks at contracts, making sure that they comply, and they're not, and the legal counsel is not in compliance. We're spending public dollars. And I think that compliance needs to be done. We're spending public dollars. My question is, why don't we go out to bid? The alert engagement is no different than any other vendor. I know it's been stated to me that this is professional services. Then if it's professional services, still we can go out to bid for this. I think it's injustice and not fair to the public and public spend that we're allowing this to continue and not address the policies set forth in our diversity policy of JPS. I think it's a slap in the face in the system, and I would ask that this board not approve something that does not comply, and we ask everybody else to comply. I don't think that's fair.
Mr.
I'd
Bose?
like to add one other comment to this agreement. We talked in the past about looking at what services, our legal service, is it the best for our system that is a billion-dollar organization? In all other departments and services, we have bid it out. Every service almost that I can remember that's been here for that long, that's been here a time. Companies that we've done business with for 20 years, we bidded those out. We bidded out the ones for finance. I do not believe that we need to continue to make an exception that we will not look at this from the institutional point to see if this is the best services for JPS. We might get it, but I think we do a disservice by not doing it. We've talked about it, but we have not moved forward. We continue to renew the contract. That is one of the reasons I would suggest that if we renew it, it's for a year. But in the meantime, we look at, are we doing the same thing that other public hospitals are doing? Why are we so different? Is it the best for us? I think we owe that to the taxpayers.
Thank you, Mr. Bose. Any other comments? I have a motion and a second on the floor. Are there any other comments? And I'll certainly entertain those comments. Mr. Fisher, I'm sorry.
Thank you, Mr. Chairman. Trying to gather my thoughts here as I say this. Number one, in my civic life as well as this life and service for the hospital district, I do not believe, and I am actually glad that the state law gives us the opportunity to have professional services outside of a bidding process. I do not want your, and this hospital district's legal services, professional services, have to be sought out to the lowest bidder and be under public pressure to accept such an agreement. I think that would be a huge disservice to all of us, as well as the citizens and taxpayers of Tarrant County. I feel that same way when this comes up in the city. I've said the exact same thing. I'm firm on that. There's a reason that we are allowed that leeway. Now, in this engagement letter, you will find Adams, Lynch, and Lofton's rates are far lower, in my opinion, than what we would see with a different set of legal counsel. Now, we can talk about whether we need counsel in-house or we need outside counsel, and I'm going to tell you, whether it's Mr. Adams sitting in that seat or somebody else, I want outside counsel. And quite frankly, I want outside counsel because I want an attorney and legal representation that represents us and is not, and this is not meant to be offensive to the CEO, but someone who reports to the board of directors and not someone that sits up in an office next to the CEO, because filters get installed. Period, end of story. I'm not saying that that would happen with your leadership, Mr. Early, but I'm just saying I want, and it's the same with the city. The attorney for the city of Bedford reports to the city council and the city council only. So I think that we need that. Now, I think that there's plenty of agreements when we talk about diversity that this board approves and goes through, and they say, well, we've made our best effort. There was one, ski data or whatever, a $5,000 good faith effort. I think that Mr. Adams has presented us with information here that shows his good faith effort and his firm's good faith effort towards diversity. And if there's no other proof of malice, or that somehow that our current representation has done a poor job, what are we doing? Are we just doing it based on the color of his skin or his firm's skin? He has done a fine job for I don't know how many years of representing this hospital district. There's been no proof in any of these discussions when we talk about renewing our legal counsel's contract that there's been malice towards the board or to the hospital, or that there's been any mistake made. Every day that we come here and we are not moving this district forward is one day that we're taking a further step back, and I think it's ridiculous. And arguing over our attorney's contract that I think is fair, and I mean, we can get into Mr. Norad's fees, but you could compare them, and I think that we're getting it. But I think that we're getting a fair deal. That's why I seconded the motion. Thank you.
Mr. Chairman, I beg to differ. And I never brought up race. I never brought up malfeasance. I never brought up fairness as far as his work ethic. I asked about compliance with the policy of this hospital. Diversity does not address race. Diversity deals with diversity. That's what my question is. That's what I'm asking. Yes, we've approved many contracts, but his contract or any other contract should not be excluded from the pot. That if we're going to make everybody else comply, his should comply. That's all I'm asking, is that we look at that. Yes, in the lead engagement, I personally talked with our legal counsel. I've sent some language that we could put in to hopefully help with that diversity. But there has not been any evidence of compliance with diversity in the 8-9 years I've been on this board. Now, if you want me to bring the community in and express that, I have no problems. That's just a phone call away. And I'm at that point of feeling that maybe that's what we need to do, because I've asked it repeatedly. All we're saying is compliance.
Does Mr. Adams, what he's outlined in his representation letter, his military service, as well as the efforts he's made, doesn't comply, in your opinion?
It complies if he's certified by the state as a veteran.
Does he have to be certified by the state as a veteran?
If he's gonna use that designation.
I don't know the legalities of that. There's no denying that he's a veteran.
Gentlemen, I would be glad to say as chairman that obviously we have a difference of opinion. I respectfully, Ralph may disagree with the interpretation of whether we're in compliance or out of compliance to the policy versus vendor versus professional services. I have likewise read the policy, and I may respectfully disagree that he's not a vendor. He falls under the exemption of professional services. As chairman now, I look back, you refer to 9 years. I have not been on this board 9 years. I looked at this contract. It's very similar to the contract that was signed when you were vice chair. It's very similar to the contract that was approved previously. You as chair, you had reached out. Mr. Montgomery's not here. I'm not going to put words in his mouth. You and I, Mr. Montgomery, met on several occasions along with Mr. Adams. And to be transparent here, I think there were certain things that were attached, whether they were required to or not. That's all a public record on the portal. And so again, I think if there's, I know you're not making threats, you're not making comments. We're here to make a decision for this hospital district. And I guess that's, I respect your opinion. I'm just saying as I'm dealing with a situation where we need to move forward, we need legal representation. There are a lot of things on the deal. So at the end of the day, I think we're going to have to make a decision, each board member, as to what they truly want to do. Warren, you had your hand up.
Yeah, I had a question. This is a 2-year letter of engagement, is our current one a 2-year?
Correct.
Yes, they've been 2 years since 2007.
Can we make it 1 year?
Take an amendment to the motion.
I'm happy.
Is there any opposition? Is there any reason why it needs to be 2 years?
I made the motion for 2, and I'm sitting right there, and I'm gonna explain why if I get a chance to speak again, okay?
Dr. Lake?
I don't see any exclusivity in this contract, in the sense that in the 7 years I've been here, there's been a variety of law firms that have represented this hospital other than this law firm. And you'll excuse me, but I read the details of this contract, and there's an item 4 in there that says Adams, Lynch, and Lofton agrees not to exclude for any reasons of race, sexual, gender, whatever. So there's a clause in there that says they don't intend to exclude that either. So to me, I'm the kind of guy, if I make a motion, I'm gonna leave it the way it is, and if y'all wanna vote it up or down, you can vote it up or down. But I'll leave the motion as it is at 2 years.
Well, people often make changes at 1 year, and so I just wondered if there was a reason why there was a 2-year pattern. I'll just say that whenever this came on, whenever I saw this for the first time, of course, I've known Mr. Adams for decades. Back when I was young, I think even he was young. And so there's a unique circumstance here because he was on the board, and I consider that we generally get Cadillac service. And we don't pay, I wouldn't say we pay Chevy prices, but we don't pay Cadillac prices. We pay a good price, we get an excellent service. And I wouldn't expect, I'll just say it openly, I don't expect this relationship to last forever. At some point, Mr. Adams will find he wants to do something else. And that the idea of having $1 billion organization that has 0 attorneys on staff that do attorney work is probably unique in this world. I don't know another organization in this entire planet that has $900 million plus going through it a year that doesn't have a workaday, I look at care of ordinary contracts and take care of that business. Now, I haven't made a stink about it because I think that the law firm we have is doing a fine job, and I expect that to be a temporary circumstance. It's based on previous relationships. And that's why I haven't made a big deal about it. And I'm not opposed to this agreement here. I just was looking at the 1 year versus a 2 year. I adjust my rates every year. Maybe we ought to lock them in while we can and keep it at 2 years. I just didn't know. It's just a question.
If I could say something more, and I heard your comments, the agreement, you're fine with it is, but I guess the other thing I'd like to mention is this agreement, as in all prior agreements, has an out clause. It's in there. This board can determine, correct me, I'm not the lawyer here at the table, but you read the agreement. There's an out clause in there. I think also one thing has been added to this one, and I think, again, not being insensitive to exactly where Reverend Emerson's coming from, is that this contract is set up, whether you believe in the interpretation of professional services or vendor, it has an additional addendum that's attached that the firm, Mr. Adams' firm, is willing to meet quarterly and make sure that he is continuing to address the issue of diversity. And I want to make sure that we heard Reverend Emerson's comments. We have met. I'm just saying at the end of the day, that was not on the previous contracts. There is a committee that's not me, it's not the CEO, but yet the CEO serves on that review committee. I serve on that committee. I think the vice chairman, if my memory is correct, is on that committee. Reverend Emerson will serve on that committee along with the chair of finance, which all bills are now sent as per the last contract. They go directly to finance. There has not been an issue the last year. All set goes to Sharon also. So we may disagree philosophically as to the interpretation of vendor or professional services. But at the end of the day, I keep hearing the word quality and fairness in the amount being charged is not the issues. We're back, Ralph, dealing with the issue you brought up. And again, I respect those comments, but if I have a situation where I have a motion to second, is there any, yes, Dorothy?
I want to just clarify something on the record. I'm not saying that Neil's firm isn't doing a good job. What I am saying is that most of the companies that the majority of the companies that we've been working with have been doing a good job, but that did not stop us from looking at that to make sure that was the best service for the district. I am saying not on a bid, because I think that if you have an outside service, that's how you got this one, was a bid. I'm not saying that. I'm saying that this institution do need to look at, gives this the best system for us? We haven't looked at that since I've been on this board. We've talked about it. We said we was going to pull together a group and have some input. We might come out with the same deal, but I don't understand why it's like hands off, you can't look at anything. And that's what I'm saying.
And I want to make sure I clarify your comments there. One is that obviously is not the issue before us, but I hear what you're saying is, should this institution look at, is this the best model or is there another model? I think that's an issue this board can certainly address, and I'll be glad to commit to it over time for something we look into. I'll be glad to commit to you that.
I don't want to beat a dead horse, but
Right.
That's the same terms we said. We pulled together a subcommittee, and suddenly we are right back where we are. The last time we were going to do it, we had the bond. We don't want to interrupt because it might affect what we were going to do with the bond, which didn't move forward at that point. So it's an excuse that we use. We continue the contract, and every time we come up and we still don't do it. I'm saying that this organization, we as a board need to look at that. I will always think that you will still have a board lawyer, whether you have in-house or bring in lawyers on the internally, that we would always have a board lawyer that would represent us. So I do not believe that just because we have done it this way, that we should not look at doing that. Now, if you're saying on the record that this is going to be something we're going to do, we're going to get a report so that 2 years from now, I will not be having this same conversation, because this is the second time we've had this conversation, if not the third.
And Dorothy, I have no problem with that. I'll be quite frank.
Mr. Chairman,
Yes, Ralph.
I am not trying to carry this long, but I need to say that my concerns are not just addressing legal services. You know, as long as you've been on the board, and anyone else who's been on this board, I have raised the issue about diversity since I've been a board member. And what I'm saying to you now, that I think it's truly a slap in the face of the community and the tax dollars we spend to not at least look at that issue. I'm not attacking legal. I'm not attacking Neal and Lofton. I'm attacking the issue. And all I've asked is compliance. I've not dealt with his fees. I've not dealt with race, gender. I'm talking about compliance. I would submit to you that there have been contracts that have come before this board where I have said we needed to quit checking the block good faith effort, or they're excluded, they are exempt, because many of the physician groups and contracts, even though they may be exempt, meet the diversity goal, and that would look good for the hospital. And so I have been an advocate of that, and I'm still saying that at this point. I feel we want to push through this when I think that we need to make sure that we are complying. That's all I've asked, that we comply.
Yes, Trent.
I personally would prefer the discussion to be executive session, I'll tell you that, and I understand why it's open, but it's obviously awkward for Mr. Adams to have to sit here and hear everything and not find an opportunity to respond to it. I'd like to hear what he has to say about this.
I've met with, first of all, I provided a proposal to the chairman and the board, the chairman of finance, and to Ralph. I got feedback from Ralph on this issue of MWBE, and I got feedback from Mr. Powell. I got feedback from Mr. Montgomery. I incorporated in some form most of those comments. I've made a commitment to make an effort to, as Ralph and I talked at length, that we can go out and spend $75,000 to $100,000 or $200,000 hiring a lawyer in my law firm, but who's not an owner, or may or may not be. But the long-term effect of diversity is developing a program that has a legacy that increases the opportunity for minorities to participate in this, and I've committed to Ralph to work with him. We're about to have a new dean at the Texas A&M University School of Law, and I had already talked to the previous dean, but he's now chose to move to another position at A&M. But I've told Ralph, or advised Ralph, that he and I need to sit down with that dean, develop a curriculum for healthcare lawyers that we emphasize minorities pursuing that career, and and I have a passion for not only healthcare because of my experiences involved in this institution for 17 years in some capacity, but in higher ed and education, and so I think both of those go hand in hand. We created 3 years ago, as I indicated in my attachment, an intern program. 2 of those 6 kids have been African American. 3 out of the 6 have been women. I am instituting this fall a clerkship that emphasizes second and third year law students that will wish to pursue a career in healthcare. And I want to sit down, and Ralph and I have talked about this in our last visit, that he and I go sit down with the leadership of the law school and see if we can't develop a pathway for minority students to become and be interested and be qualified to enter the legal field in the healthcare area. So Ms. Adams and I have created a scholarship there that will also be available to an endowed scholarship be available to minorities, as I've told Ralph, and that scholarship will be pretty significant. It's designated for second, third year law students that pursue a career in healthcare or education law. And so I've also indicated that I'm willing to go to the Dallas or Fort Worth minority chambers of commerce and other organizations. Ralph mentioned one that I know of, and I said, Ralph, I said, I need your help, and I'm more than happy to welcome your help to open those doors and identify folks that I can work with. So I'm committed to doing that, and I believe in it. I believe that, as Reverend Emerson knows, and we discussed, I'm a chairman of the board of the College for All Texans, which is a parallel foundation to the Texas Higher Education Coordinating Board. It has 2 programs that have gone into high schools, identifying the high schools that are the highest percentage of non-applying to college, and most of those are minority predominant high schools in this state. And those are programs that are developed for first generation folks. There were no family members ever going to college, and we know what those percentages are once 1 goes or 2 goes or 3. And I'm willing to put those resources together and pull those down here in terms of some of these programs, and Ralph and I have talked about that. And so I'm committed to those kind of things because I think those are long-term effect. Those resources and the things that we do there makes a difference in people's lives over a long period of time, and I'm committed to doing that.
Certainly, Trent.
It's difficult to articulate everything you think about a situation like this, so you try to keep it synthesized. First of all, I want to say that for the last 7 years, I've worked very closely with Mr. Adams on the model, on the legal model at JPS. Several years ago, I had concerns about the cost, not necessarily saying that his rates were too high, but understanding how that cost applied to JPS vis-a-vis a comparison between in-house counsel and external counsel. And Mr. Adams made, in my consideration, a good faith effort to look at that model and change that model. And we did make changes to that model for the concerns that I have at that time, which frankly were cost concerns. In addition to that, there were concerns relative to our ability to look at outside counsel when necessary and to bring outside counsel in. And Mr. Adams worked closely with us, and Mr. Early was helpful in that, to make certain that whenever the district needs specialty counsel, that we can avail ourselves to specialty counsel. And Mr. Adams supported that effort, and I think we have dramatically increased the specialty access legal, and we've had a lot of specialty issues over the past several years. So I accept Mr. Adams' response relative to the desire to increase diversity. I do know it is difficult to find the folks that are willing to come in and work in that field, and a lot of them would make a whole lot more money going somewhere else, and I do respect that. I don't at all dismiss the difficulty of being able to increase the diversity within his firm. So, you know, having said that, I have deep respect for my colleagues, Ms. DuBose and Reverend Emerson, relative to this effort, and I salute that effort, and I think we need to continue to make that a paramount effort. I personally, not trying to influence anybody else, but my feeling is that it's never been an on and off switch. It is a process, and it's an effort. And has it gone as fast as maybe we'd like it to? Probably not. But I got to weigh it against the big picture and against all the other components that we look at relative to legal services at JPS and where we are today. So having heard Mr. Adams' response, I'm confident and have faith that he will follow up on that. And I think we as a board need to make certain that that occurs. But I'm gonna vote to continue supporting Neil as counsel at JPS. I would like to see us continue to focus on this effort, and I'd like to see us continue to make it something that the board stays engaged and involved in. But I don't think it's an effort I would be able to say this exclusively, this one thing is the reason that we should terminate the contract. So with all due respect to my colleagues, that's how I feel about it.
DT.
I think you're going to be surprised with what I'm about to say.
We are always surprised. As long as you say it loud, then we can hear it.
When it comes to health and legal counsel, I want the best surgeon that I can find, or the best doctor I can find. And when I look at legal counsel, I want the best advice, who can protect and mitigate the risk for the institution. And also, there is continuity that we need to get things rolling before we look at, I don't have any problem with the service itself. I'm an employer myself. It's hard to look at diversity. You can extend, but they have to accept, and they have to have subspecialized. And a lot of law firms subcontract out to other law firms that probably may already address some of the diversity because they have more to offer for a lot of legal counsel also as well. So I don't have a problem. I think my challenge is, at what point do we want to bring it in-house? And let's just have those discussions down the road where it's appropriate on the agenda, and look at to see what year we want to bring it in and all that stuff. The rate is really, really good. The service is good. And I think we need to look at mitigating the risk. And whoever can bring that to the district, I think that's where we need to be focusing on, because these are very critical because you got to deal with patient safety, you got to deal with compliance, fraud, abuse, and all sort of things. So That's all I have to say, but I think we should go ahead and take for the vote and discuss things later, at a later time.
Thank you, DT. Any other comments? I'd like to summarize something real quick. As chair, we could have easily discussed this most likely in closed session. This is an issue, I think Ralph mentioned, has been something for 9 years. I have tremendous respect for Reverend Emerson. He knows that. At the same time, I think it's good to hear everyone's comments. We've been very transparent about this. I also hear from Mr. Bose and from Mr. Wynn that we need to consider other forms possibly of legal services to this district. And I think those are something that this board can look at and hold me accountable as we move forward over the period of my service and as chairmanship. So I appreciate each and every one of your comments. I know it's a subject that is not the only subject here, but again, Ralph, I respect your comments. I respect your position. Everyone on this table is a member of the board, and each one can vote as they see fit. But again, unless I have no other discussion, there is a motion and a second before the board, and I would call for a vote at this time. And I prefer, if you would, to raise your hand. And I call for that vote now. Thank you. Just all in favor? I'm sorry, all in favor, yes. All in favor. Those opposed? Thank y'all very much. Next item of business. Yes.
I want to thank the board. And I want to speak to Dorothy and Ralph, who I have utmost respect, having sat in their seat, talked to them and represented them through the years and had many, many discussions. And I want to assure you, again, Ralph and Dorothy, you and I have not had this discussion, but I've had it with Ralph. But I want to, I want your help. I really do, and I really I beg for that help, to open doors and for us to help young men and women who otherwise can't get there. And I want to be part of that vehicle that helps us, but I can't do that by myself. So I appreciate the confidence of the board, and I look forward to working with you. Thank you.
Thank you, Mr. Adams. And like I say, the next part of business is item number, let's see, we go
Before
to
you get away from that, I do have one
other legal matters.
Legal, in behalf of Mr. Chairman of Finance, Mr. Montgomery, we do post the contracts that were negotiated and by the administration and executed for the month of May. There were 32 of those contracts, and this list of contracts was posted to your board portal. So if you've got questions regarding those, then let me know. Thank you.
Okay. Thank you, Neil. There being no other items at this particular time, we're going to recess to close session at 2:55. Thank you all very much. Let's take about a 10-minute quick recess. Thank you. We'll reconvene in open session. It is 4:05. We will go back and review under item 12B for consideration at this time.
Mr. Chairman, I'd like to make a motion that the Board of Managers approve the agreement for purchase and sale of property with an effective date of April 12th, 2017, regarding the purchase of approximately 6 acres of real property located in Fort Worth, Tarrant County, Texas, and further approve the closing and funding of this agreement for purchase and sale of property, and authorize the President and Chief Executive Officer of the Hospital District to execute all documents consistent with the agreement for purchase and sale of property and title company at closing as required by the agreement for purchase and sale of property.
I have a motion.
Second.
I have a second by Dr. Lowry. All those in favor say aye. Aye. Any opposed? It passes. Thank you very much. I know a couple of you have the last
Members,
thing
I
is.
appreciate that. Thank you.
Yeah, and Doctor, if you'd cover the privileges, please.
The medical staff, the medical executive committee recommends that the applicants for medical privileges be approved.
I have a motion by Dr. Weber. I have a second by Mr. Wynn. All those in favor say aye. Aye. Opposed, no. There not being any additional business, I'll say to Dr. Ziegler, thank you for the medical staff and everyone being here today. Thank you all. It's been a lengthy one. Thank you for your input. Thank you all very much. We stand adjourned. Thank you.